Шановні колеги, ми
Dear colleagues, we continue our work in the Ukraine Crisis Media Center. The topic of the next event is start of season of flu and ARVI and prevention and treatment. Oksana Sivak, Deputy Minister of Healthcare of Ukraine. Also Tatiana Dekhanovska, Head of Ministry of Healthcare Center of Influenza and ARVI. And also Olga Golubovska, Senior Non-Staff Infectious Disease Specialist at the Ministry of Health of Ukraine. Welcome on stage, dear guests. Oksana Sivak is given the floor. Welcome on stage. Dear colleagues, dear friends, I don't want to say patients, because we hope that we will not be patients when we are speaking about flu. Today we would like to tell you about flu. As you may know, epidemic of flu happens every year in Ukraine unexpectedly, and we would like to focus on this issue and to speak about preventive measures and also to speak about treatment. According to the data of WHO, such strains, California virus and Hong Kong strain will be present this year. And together today we have experts who will tell you about it more. So I give the floor to my colleagues, but first I would like to state that before thinking about treatment, let's first be ready for prevention. And in Ukraine we have vaccines. They are bought by pharmaceutical companies. The vaccination is recommended. It's not obligatory and is not financed by the state. That's why we call on you to be vaccinated. It's not obligatory, but recommended to all people, especially for risks groups, children and elderly people. So preventive measures. You should wash hands and also if you feel ill, stay home. Just stay home if you fall ill. It is good for a person not to complicate health conditions and also for other people outside home, at work and at school, in order not to disseminate the virus. And in case of high temperature, consult the doctor. You can call and the doctor will come to you, or you can visit the polyclinic. You can get consultations and get advice on further treatment or prevention. I give the floor to my colleagues. Thank you, Oksana. Now the floor is given to Tatiana Dekhanovska. From the 3rd of October, we have new data about those who fell ill of the flu and the ARVI. This is the new season of the disease started, and what is a week that started on the 3rd of 153 people fell ill. Hospitalized are 3,700 people, and out of this number, 75% are children. And some tests were made immunofluorescent method was used, and 109 samples were selected. Out of this, 33 positive. Virus of flu was not found there, but there were para-flu, 51%, adenovirus, and respiratory viruses were identified in these samples. Also, by the method of link reaction, the virus of flu was not identified in any of the oblasts. So epidemiological threshold is not was not overcome, and there are some respiratory infections. Children now go to school, and they stay for a long time in premises, and students who like to attend some gatherings, and also people come home from vacations, and we live in big cities. We contact each other not only at work but also in the shops, in the markets, and this creates an atmosphere where the virus circulates and disseminates. So maybe questions. Thank you, Tatiana. Now the floor is given to Olga Golubovska, and then we will have questions. Good afternoon. Traditionally, we start to speak about flu. This is a very important information campaign, and previous year we faced difficult situation connected with dominance of lethal H1N1 strain of this virus, and we hope that this strain will not be dominant this year, because flu, it always changes and it gives time in order to come down. And the bright example, in 2009 we faced this strain for the first time, and everything was much better with vaccination, and now the level of vaccination last year was 0.3%, and because of this we saw lethal cases. 400 people died of this. Comparing with previous years, these were 10 or 20 people, no more. And this season three strains circulate, H3N2, Hong Kong. Nothing special about this virus. It is not pandemic strain. It is just different. This virus, it is always changing, and it changes. It's from H1N1 also will be present, and virus of flu B that is rather light. So what I would like to to draw your attention to, of course, this virus will exist always, and we should minimize side effects, minimize the serious cases, and to prevent death. So I want to remind to you traditional groups of risks. So if we are speaking about seasonal H3N1 and B type, the most vulnerable people are children and elderly people. H1N1, new pandemic strain that appeared in 2009, it has different groups of risks, and it is dangerous for adults, for young people. So who are those groups? Obese people, patients with diabetes, bronchi asthma patients, and cardiovascular disease patients, and people who take some medicines connected with the cardiological problems, and they can have complications in case of being infected of H1N1. That's why these patients, they should think seriously about vaccination in the nearest future. And if a person cannot be vaccinated, they should in the first hours, they should attend the doctor and to consult, be provided with consultations. So this inhibitors of specific virus, they work, they are the most efficient in the first several days or in the first several hours. And taking into account the experience of previous years when young people died, unfortunately. The average time of addressing was up to 10 days. Even there were cases when people were brought to the hospital after 14 days of illness. An information campaign was carried out, and people got information on this, and we believe that information campaign is really important. And in several weeks, this correlation was so patients were admitted at hospital on the first or fourth day. And I would like to draw the attention of doctors, especially of those who work in the ambulances and in hospitals, and that they should pay attention to it. If there is a suspicion that this is flu, and flu differs from other respiratory viruses, it has a clear clinical view that is described in our orders, and we have order of the Ministry of Health that regulates the treatment of patients based on American recommendations, and there it is said clearly what to do. And if there is a suspicion that there is flu in the patient, so these patients, they should be treated appropriately according to the protocol, or the patient should be referred to the hospital as soon as it is possible. And it saves people's lives. And I repeat, we will hope that this year the situation will not be so complicated than the previous year, but we want to remind you about this. Thank you. Thank you, dear colleagues. We have up to 15 minutes for questions. Please introduce yourself.
Oksana Sherbina, TSN 1+1 TV channel. My question is, where vaccines, when they will be available in our drugstores and the network of shops? The vaccines have been registered and tested. This is proved information. One of vaccines is available in drugstores. Influvac vaccine against flu, produced in Netherlands. It is available in our drugstores. GC flu vaccine, it has already passed expert assessment, and it depends on pharmacological company when they deliver it to our drugstores. Whether any condition was set to the company that they should provide vaccines within 1 week or 2 weeks, so that they are available in outpatients clinics for children and adults. So have you set any period. Yes, we set the deadline as soon as possible in general. The expert assessment was conducted within very short term, from the document submission. I think that by the end of this month, as the pharmaceutical company says, this vaccine will be available in the drugstores. Вікна новини. Darina Kirachuk. The information is disseminated that in Ternopil region there is a Kasaki virus outbreak. This is not to the topic. Well, this question will be off records. You can ask it in the hall. And Inter TV channel new Gong strain, does it differ from other strains, and how it threatens? I told already. H3 and 4. It is not a new one. It was registered in 1969 first. It is not a new virus. There were many cases of deaths, but it was circulated for within certain years, so our population has rather high immunity. More than 40% of our population has immune reaction response to this strain. As concerns efficiency, which and efficacy, which is claimed by the producer, it is up to 95%. But last year we had cases, fatal cases of influenza. No one of those people were vaccinated against flu. If the person is vaccinated against flu, and all of a sudden if such a person gets sick, then this disease will not cause death. The symptoms are similar to all other the flu strains. There are no different symptoms. All strains cause the same symptoms. They say that viruses have already been circulated. And what does it mean, immunity? Is it available only when the person has been ill at least one? There are several cases when the immune system provides response when the person was vaccinated, and at the end of the second week upon vaccination, the immune response is produced by this person. The second group of people, those who have already been ill with this strain, the person can experience even light form of flu. Sometimes the person gets ill in the light form or medium severity form. He goes to work and he communicates with people, and he is a source of infection for all other people in environment. So I call on you once again, this is your inner culture. If you get ill, stay home. When you expect the epidemic, when do you expect it to start? The first patients, the small outbreaks, this is the first start of epidemics, and now people are mobile. This day the person was in Singapore and tomorrow he is in Ukraine, and is a source of some epidemic threat. When we expect it, it is hard to say. In Ukraine, all our regional centers are involved in oversight of any outbreaks of flu. We try to catch the first cases of diseases, we register them and start events to contain the threat, dissemination of epidemics. Are there any questions? Final question about these types, about the strains of flu. For some strains, they cause diseases among young population, and some are dangerous for elderly people. And what complications can they bring to? I draw your attention. There are 3 strains in circulation this year. We can get infected with one of them, H1N1, was dominated last year. It is characterized by special risk groups at everything new which appeared in infectious disease systems. Any new strain, it first make young people suffer. H1N1 differs from other flu strains. It can cause primary pneumonias, which then are added with acute respiratory syndrome, with which we can't control it. We can prevent it, but we can't control it, and we can't help people survive it. So doctors should describe this problem on sites. In some cases, timely treatment can help. All other strains, they are dangerous to children and elderly people. These complications include nervous ones, serious meningitis, and also peripheric nervous system could suffer, even polyneurosis in 3 weeks after disease start, and bacterial complications such as sinusitis, otitis, and other bacterial complications. Thank you, dear colleagues. At the end of the briefing, we will be glad to see you again. The next our event will be at 3 o'clock sharp.